A very warm welcome to Global Healthcast, brought to you by Global Health Press. Our GHC special today covers COVID-19 in the Philippines. For this topic, we invited three top experts from the Philippines: Professor Lulu Bravo, Professor Rose Capending, and Dr. January N. Pardo. A very warm welcome to my guests this morning, and may I briefly ask you to introduce yourself, and maybe we start with Lulu.
Hi, Joe, and good day to you. I'm Lulu Bravo, a professor emeritus of the University of the Philippines College of Medicine. I have been working together with various stakeholders, both in government and in private sector, internationally and locally, to improve vaccine communication and advocacy.
Thank you, Lulu. And may I hand over to Rose?
Hi, Joe. I'm Dr. Rose Capending. I'm a pediatrician with subspecialty in infectious diseases. I'm also a clinical trialist. I have been conducting for almost 3 decades on vaccine trials and epidemiology of vaccine preventable diseases.
Thank you, Rose. And last but not least, Dr. January N. Pardo. Can you introduce yourself, please, Janie?
Hello, Joe. Thank you very much for the invitation. I'm Dr. January N. Pardo. I am a member of the Philippine Foundation of Vaccination, and as well as the Vaccine Study Group of the University of the Philippines National Institutes of Health. Recently, I am also a graduate from the Master's Program of Vaccinology and Drug Development from the University of Siena.
Thank you very much, and I can highly recommend to our young audience this course in Siena. It's really a wonderful course with a lot of people around the globe having been trained in the Siena Master Course in Vaccinology. Without any further delay, let's start with my first questions. And the first question is, what was the medical impact of COVID-19 in the Philippines?
Well, Joe, there was a huge impact of the pandemic towards the health system of the Philippines. From our Department of Health, the data shows that there was almost a little over 4,140,000 COVID confirmed cases. Most recovered, but unfortunately, we did have 66,800 deaths, which is occurred mostly in the elderly group 50 years and above.
Rose, can you add anything to the data from your view?
Okay. Joe, the pandemic really put our healthcare system to the test. So it showed us early the limitations of our healthcare facilities, our equipment, our personnel, and this really overwhelmed our healthcare system. And this prompted the government and our private sector to band together, to team up, and then we're able to establish 1,800 old and new facilities fully equipped to manage COVID cases. And Joe, amidst these challenges, our healthcare workers stepped up to perform their duties despite their fears and worries.
My question to Lulu would be, what was your impact on vaccination services for children?
Well, Joe, aside from the many things that happened, the most important to me is the reduction in basic services that involves childhood vaccination. It was limited, it was compromised. This issue actually was coupled with misinformation regarding COVID and the COVID vaccines. And it resulted in a greater vaccine hesitancy and definitely a decrease in childhood vaccination rates.
So we started with the impact from morbidity to mortality to good news, everybody stepping up, helping out, healthcare workers, going out and providing services. Good and bad news. Now let me go and switch a little bit to what did the Philippines do to address the pandemic? What were non-pharmaceutical interventions that appeared in the Philippines? And maybe we start with Rose.
Mm-hmm. Joe, when it came to non-pharma intervention, the Department of Health had put up a guideline, the quarantine guidelines which actually underwent several revisions depending on the situation. We started with the national ECQ, or the national the enhanced community quarantine, and then we moved on to the modified ECQ, and then to granular or zonal lockdowns, and then to an alert level system. The quarantine measures were already in place from March 12, 2020 until November 2021, when the alert level system was implemented, until November of 2023, I think it was July 2023, when the state of public health emergency for COVID-19 was withdrawn.
So that were the quarantine measures, directly reducing exposure. Janie, can you add a little bit on vaccination and other items, specifically for the healthcare staff?
Well, the restrictions, other restrictions also in place, is not only required for healthcare personnel, but as well as for general public. So it includes a strict requirement to receive the vaccination before the workers can go back to work, or even for the general public to be able to travel or even go to the mall. It required the use of personal protective equipment, especially if you are going to public spaces. And the government limited the number of people allowed per public transportation and in public areas. But the downside of those restrictions resulted in a very limited supply and high prices of masks and protective gear. This resulted in people using alternate means of protection, despite these means being not proven to provide adequate protection.
Very interesting. Yeah,
in
go ahead.
transportation, that resulted in a very high fare and gas prices.
Very interesting. So that has to do with the financial aspects. And maybe, Lulu, can you add a little bit on this?
Well, that's right, Joe, because with the high prices coming in, there was really lack of financial and funding support, although government tried. But it is difficult to sustain the food supply and the medical needs of all the constituents, especially during the ECQ, or enhanced community quarantine. And this has resulted in many who did not report their symptoms, or who were afraid that they will be found to have COVID. And so they will just hide, or they will just come out, fearing that they could not be continuing work if they were to be found out. So there were also some information that were giving, misdirections or misinterpreted, and there was difficulty in confirming whether this information is true or fake. So a lot of these things really were happening during that time.
Yeah. Lulu, you started speaking about the negative aspects of the pandemic, how people try to circumvent the rules that are there to reduce exposure, and they find a way, to deal with the situation. What was the total impact, or some other aspects of the impact on the quarantine and the pandemic to the daily life and to the economy of the Philippines?
Well, this was really it led to a big impact economically. And as I said earlier, high prices and people really losing their jobs. There was decrease in tourism. The Philippines is a very nice tourist area, by the way, Joe. But there were people who could not go around. The traveling was limited, and the increase in all the prices and goods were there, commodities. But you know what, Joe? There was this Filipino resilience, which we call bayanihan spirit. It's like working together. And this is when we realized that businesses also tried to help. There was some people who started to do their jobs by delivering goods to people who did not want to go out of their houses. So these are the people who wanted to just have this business of delivering and working through online. and using whatever they have, innovative ways to earn a living. And of course, there were businesses who actually managed to work from home. People were asked, okay, you can work from home, you can come in only once a week. And employees like that because they realized that this can also work. And of course, there was these opportunities for companies finding alternatives and the creation of community stores. People would support others by just dumping some goods there for others to enjoy or to have them given free. And this is what we really call helping each other. Right, Joe? I think this is something really positive.
Very, I like that Bayanihan, whatever to pronounce it. I like this attitude very much. And maybe Rose, speaking of how you cope with the situation, I guess we come now to the field of social and psychological impact. Can you give a little bit information on that aspect?
Joe, the quarantine measures really had both positive and negative impact on the society. On the downside, there was less social interactions. Our kids were unable to attend school, and also there was this fear. No, you had difficulty of accessing the basic services, and also, Joe, there was a stigma attached to being COVID positive. And also, of course, we all know that healthcare workers experience burnout. But on the upside, the people became more aware of the importance of health and sanitation, and also the online schooling became more accessible. And you know what, Joe? Companies, the management of these companies implemented policies on safe policies safeguarding or protecting the physical and mental health of their employees. And I think there was really a heightened awareness of the need to take personal precautions regarding safety and health, including mental health.
Yeah, very, very interesting. And maybe a last aspect here would be long COVID. Janie, are there any data on that?
Well, unfortunately, Joe, although long COVID cases have been widely recognized here in the Philippines, there is no actual hard data readily available. There are more of anecdotal stories from both patients and doctors sharing their experience on what happened to them after COVID. And of course, there are some records that show that there are a lot more respiratory cases that occurred even after COVID infection.
So we covered so far the impact in your country, and I heard about the negative aspects and about the resilience of the people of the Philippines to address the situation. Maybe we change a bit to prevention and to vaccines and vaccination. Janie, when did vaccination start? When could you start helping people with prevention?
Well, vaccinations in the Philippines started as early as March 2021, with the initial prioritizations for healthcare workers and essential first-line personnel, eventually followed by the senior citizens who were the highest at risk. This followed on with other high-risk individuals and eventually a general public vaccination program. We were happy to report that 95% of our healthcare workers were vaccinated against COVID, which is the highest vaccine uptake group. Unfortunately for our senior citizen group, we did encounter a little bit more difficulty. There were only 70% that were covered with COVID vaccinations.
Yeah. And Rose, can you cover how you vaccinated and which vaccines you used?
Okay. The initial recommendation was a two-dose primary vaccine series from any vaccines provided by Sinovac, AstraZeneca, Moderna, and Pfizer. The recent recommendation is a two primary doses plus two booster doses and from any of the regulatory approved brand. And Joe, there is the mixing of vaccine types is not an issue here.
Interesting. So very pragmatic approach. Very interesting to learn. Um, let's step back a little bit with all the information we have. And my question to Janie now would be, what are the main learnings from COVID-19 for future pandemics? What do you think you could do better for a next similar situation?
Well, what the pandemic showed us is that there is some structure in place for the Philippines to respond to any future emergent or epidemic situations. However, there is still need to further development to develop infrastructures and health facilities and keep them up to date, even if there's no public emergency situations.
Yeah, and Rose, maybe you have some points to add here as well.
Oh, okay. Moving forward, I think there's still a need to improve our healthcare, the health surveillance system, and also to in terms of communication that so that people will be able to respond to health emergencies and maintain adequate services. And likewise, I think it is very important to educate people on the basics about the public, about the basics on health, disease surveillance, and vaccination.
Yeah, I think this is a learning for most countries, including my own country, Germany. Surveillance was not really ready and not always very helpful. And the other points, very, very similar, I heard from around the globe.
Joe,
Maybe we.
Joe, may I add that I think it's very important about having this to educate the public about information about the basics about importance on vaccination, so that it will curtail misinformation and again continued training of healthcare workers alongside the health professionals, allied professionals.
Yeah. Excellent. Yes. Yeah. And stepping back from what we heard so far, maybe I go around again, starting with Lulu. What were solutions or steps taken to help vaccination in your country? And again, maybe Lulu, you start.
Yes, Joe, this is something that I think everyone, every country could really learn from. All the learnings should be really compiled and given to us. You did say surveillance. Janie said surveillance. We do not underestimate or undermine the importance of surveillance, especially vaccine preventable diseases, because we don't want to sacrifice anyone who gets to suffer from a vaccine preventable disease, right? And COVID, dengue, all of this. Definitely, when there is a chance for us to do supplementary immunization activities, these are something that the government did during the time of measles outbreak and even polio. We had the chance to have, a breakthrough for this type of vaccine preventable disease. There is a need to vaccinate. Before, we only want childhood vaccination. Now it is a vaccination for all life stages, from the pregnant woman to the elderly, to the babies. Even these life stages need to be vaccinated. As they say, immunization should be given to everyone, everywhere, at any age. Rose said education, definitely. And it's not only education about vaccine, but educating the public on how to really train everyone to become an advocate, perhaps, or communicate the value of vaccination, because these are the future for us. It is a public health issue, and you can prevent them. There are laws in the Philippines, and I guess in other countries too, and directives to prioritize vaccination and health reporting. But sometimes these are taken for granted. We cannot undermine those. And we do need to develop, and this is something that the Philippines have been battling, against, the development on a functional, effective NITAG, a National Immunization Technical Advisory Group. There are only several countries in Asia Pacific that has done a real good NITAG. I'm sure the West have them as long as I can remember, the ASIP and all that, and even in Europe. But in the Asia Pacific, there is still need for better and functional NITAG systems to be established. And of course, it is not only the government who must be called to action here. I think the private sector, the medical societies, the civil societies, the academe, even the industry must be contributory to all of these projects, activities that we need, right?
Very good. You brought up many, many points, a strong plea for public health and to improve services there. And if I may add one thing, most of that doesn't even cost much money. You can do it by organizing it and helping there. And maybe, Rose, you have some more activities, more points that you want to stress on this question.
Yeah, Joe, our society, the Philippine Foundation for Vaccination, is an advocacy society. And during the pandemic, we engage with regarding the educational campaigns. And these campaigns primarily was on the safety, the about vaccination, the benefits of vaccination, and we also address, of course, the most important target also was to address vaccine hesitancy and misinformation. And we make use of social media and also webinars that we targeted audience across different sectors of the society. And Joe, PFB was one of the first society, Diva Dr. Bravo was one of the first society to conduct webinars. And also with our ongoing efforts on to engage and inform the public, the PFP, we launched this podcast series, which is hosted by some of our PFB members, and of course, led by our energetic and passionate Dr. Lulu Bravo. So the primarily it was on the medical issues and public health concerns that arose during the pandemic.
Yeah, and this is supported not just by doctors, even midwives, nurses,
Yes.
all the health professionals actually are working together. This is the essence, I think, of a successful campaign, right, Joe?
And
Yeah.
also, Doc, I remember, Doc Lulu, we also invited community leaders and medical and influencers also, and medical experts in various fields to spread the positive messages about vaccination, benefits of vaccination.
Yeah, we heard now Rose and Lulu, very nice and very, very supportive and very active public health actions. Janie, any areas you would like to address?
Well, as my esteemed professors have said, there is an increased awareness, not only among doctors, but as well as other healthcare professionals on the role and importance of vaccination and disease prevention. They've also realized that that knowledge shouldn't be limited only to the healthcare professionals, but it should be shared with the other allied healthcare workers and, of course, the lay people, whether it is sharing through face-to-face interaction, through information dissemination activities, and some have even stepped up to be part of the social media revolution to make sure that the knowledge and the information really passes on. Then, of course, there's also the additional interest of being part of clinical research and development, which we are so happy about because there are a lot more groups and healthcare professionals partaking in this activity.
Thank you, Janie. And as we come close to the end of our short podcast today, I have one last question, and maybe you answer just with one or two sentences, very brief. And the question is, and we start with Janie, are the Philippines ready for the next pandemic to come?
Personally, for me, we are not, but I'm happy to say that we are on our way.
Rose, what is your answer?
Like Janie, I think we're not yet we're not fully prepared. Yeah.
And Lulu, last but not least.
Essential action.
Well, we can be ready if we fight disinformation, opportunist people, and misinformation. That's DOM for you. By cultivating trust, leadership, and collaboration. That's TLC, tender loving care, in other words.
Yeah. Yeah, thank you very much. My biggest learning for this session today is the new word bayanihan. And I remember coming to the Philippines many times, there was a big storm and people were singing, right? And people dealt with the situation. I like this attitude. I think you can do more to be even better ready, but this bayanihan will always save you and will contribute to your resistance to whatever happens in your country. Thank you so much for the interview today, for your time and the efforts. Bye-bye.
Bye-bye, and thank you.